name is Meg Hager. I'm a laboratory genetic counselor for Natera's Renasite test, and I will be discussing negative genetic test results in a three-part series, and this is part 2. Many of us are probably familiar with this scenario. Imagine that you have a patient in front of you with a personal and possibly a family history of kidney disease that is suggestive of a genetic disorder. So you order genetic testing, it's sent out to the laboratory, and a few weeks later, results come back. However, when you open those results, you see that the patient has a negative or inconclusive test result. And so at this point, you may have a few different questions going through your head, such as, why are they negative? What do I do next? And what do I tell my patient? I will be addressing the second point on this slide, so things to consider after receiving a negative genetic test result. So what should we do with a negative genetic test report? Well, there's a few different things that we can think of. One of them would be to consider the utility of a negative genetic test report. We should understand the limitations of genetic testing, if any, explore non-genetic causes of the individual's kidney disease if that has not already been done, and determine if there's any follow-up that might be needed with a local genetics department after ordering testing. While it may be disappointing to see a negative test result in an individual where we are expecting to make a genetic diagnosis, there is a lot of utility in knowing what that person does not have. Oftentimes, a negative genetic test report can reduce the likelihood of a hereditary diagnosis being made in an individual. And I think it also helps to keep in mind that many people will view a negative test report as good news for them. If you think of a lot of hereditary kidney disorders, they have extrarenal manifestations that would need to be followed by various specialists for the rest of that person's life. And so a negative test result typically does not change their medical management going forward, which can reduce the need for other specialists and things to keep on top of, reducing that level of medical stress. And oftentimes people will also view the negative results as a reduced risk to their relatives to develop the same thing. It's also important to understand the limitations of the genetic testing that was ordered. So for instance, were all the variants of interest included on the panel or genes of interest? And are there any variants of uncertain significance to contend with? When it comes to making sure that all the genes or variants were included on a panel, this is especially important to keep in mind if you are ordering any sort of family variant testing, just to ensure that the correct thing was looked at. I think it's helpful to keep in mind that many panels may include different genes, so there could be differences between testing laboratories, and it's important to keep an eye on that. And then also keep in mind that certain genetic variants, such as the cytosine insertion in the VNTR region of MUC1 may be difficult to identify. So sometimes there are technical limitations that we have to consider when we're ordering testing to make sure that we're getting the correct test at the correct time. And then you may already be familiar with variants of uncertain significance, or VUS for short, but just to briefly summarize, a VUS is when the lab identifies a variant in a gene, and there's just not enough information at this time to tell us if it's pathogenic or benign. In some cases, it could be helpful to have VUS information. It may be something to follow up on in the future to determine, does this now have enough information to tell me if it relates to my patient's disease, or do we now think it's a benign change? But just keep in mind that it's generally not recommended to change medical management or test relatives for a VUS unless you are working with the laboratory and considering family studies to potentially reclassify that. These guidelines are supported by the American College of Medical Genetics and Genomics. And then another thing to keep in mind is that some laboratories may have optional VUS add-on. So if you are interested in receiving VUS, make sure that it's included with the report that you have, or you could always follow up with your ordering lab to see if you need to add VUS on if it's something that you're interested in. I know that I said this in my previous video, but I'll reiterate it here. If you have any concerns about particular variants or limitations with the test, you should be able to have an open dialogue with the lab that you ordered genetic testing from. So if you do come up with questions or you're not entirely sure with the information that you're finding yourself, um, always try to give them a call and they should be able to help you out. And then in some cases, genetic testing may be used to help determine if someone's kidney disease is unlikely to be related to a genetic cause. There are obviously a variety of causes of kidney disease. Not all of them are genetic. We know that the leading causes of kidney disease, such as diabetes and high blood pressure, tend to be non-genetic. So receiving a negative genetic test result may point us in the direction of a non-genetic diagnosis. And if the genetic testing was something that you were waiting for before doing additional screening for the patient or additional lab work, then this could be something that you would move on to next. And so thinking about maybe next steps to consider after getting a negative genetic test result, in many cases, a negative result may be sufficient at the time, and really no follow-up from a genetic standpoint would be needed. If you have any variants of uncertain significance that you want to revisit, then that may be something to consider at a later date. But, in some cases, you have a patient whose personal and possibly family history is still very suggestive of a genetic disorder. You can probably think of somebody right now lingering in the back of your mind. I think we've all had at least one or two. But this may be beneficial, or for this person, it may be beneficial to send them to a genetics provider to discuss if there's any further genetic testing options that might be available to them. For example, some people may consider whole exome sequencing, especially if there are multiple relatives who are affected and baseline testing hasn't captured anything. Or you could always revisit genetic testing after some time has passed. We're going to continue to learn more and more about how genetics relates to hereditary kidney disease as we move into the future. So even though we might not identify a genetic cause now, maybe 5-10 years down the road, we could know the gene or more genes for a certain disorder, and it could be beneficial to test then. And so that is it for part two, kind of reviewing what we should consider when we get back a negative genetic test result. And stay tuned for part three.